I'm NursingPhilosophyFassbender, and this is my philosophy of nursing. There are many important characteristics that make up a nurse. To name a few, nurses are empathetic, honest, leaders, adaptable, have a growth mindset, organized, observant, and good communicators. The American Nurses Association has a code of ethics for nurses. This code of ethics guides my nursing practice. Some of the provisions in the Code of Ethics that stand out to me are having dignity and respect for all human beings, advocating for all clients and protecting their rights, owing the same duty to themselves that nurses give to others, and finding ways to collaborate with patients, families, and other healthcare disciplines. One of the theoretical frameworks that is pertinent to my philosophy of nursing is the nursing process. This is a systematic approach to nursing care. The nurse assesses the client and situation, diagnoses the problem with a nursing diagnosis, plans cares using SMART goals, implements nursing interventions, and evaluates the effectiveness of care. Another important theoretical framework in my philosophy of nursing is novice to expert theory. This theory is based on a concept of growth. Novice nurses are still learning basic information, and as they continue to learn and gain more experience, they progress from novice to advanced beginner, then to competent nurse, then become a proficient nurse, and finally an expert nurse. To become a nurse, you must earn a degree, which includes rigorous courses with many tests, projects, papers, and clinical hours. Even when you earn a degree and graduate, you are not quite able to work as a nurse yet. Graduate nurses must take the NCLEX exam to be a licensed nurse, to prove that they are proficient enough to have people's lives in their hands. Once nurses pass the NCLEX, they then must apply and interview for jobs just like any other career. Upon accepting a job, the new nurse must then go through orientation at their place of employment to learn the organization's policies. After orientation, the new nurse will then be under the supervision of a preceptor for a few months to get acclimated to the unit. The nurse's career has taken off, but that's not the end. Nurses must continue with education, learn to manage their time appropriately, figure out which shifts work for them and when they're going to sleep in their off time, respond to the physical demands of the job, and find appropriate outlets for coping with the different emotions experienced at work. There are many steps to becoming a nurse, but they are necessary steps to take so that nurses can provide vulnerable populations with the best care possible. All of these steps may prevent people from becoming nurses and may be a contributing factor to the nursing shortage. Those who become nurses and stay nurses are admirable and honorable because of all that they've done to guarantee that they're able to care for patients. In the nursing profession, research is extremely valuable because it allows common and new practices alike to be observed, modified, and then implemented as evidence-based practice. This means that nurses use interventions that have rhyme and reason to them. Without valuing research, who knows? Nurses might not use hand hygiene every time they do a task. Some of the most important aspects of nursing include around-the-clock care. Nurses are working 365 days a year, being advocates for our patients and their families, and by advocating, we allow for autonomy, helping clients meet their personalized goals no matter how big or small they are, being a part of a support system for clients and their families as they may be going through changes and difficult times, providing resources to clients to help them meet their goals, and helping to improve clients' quality of life, even if it's in a small way. Finally, another aspect of nursing that is important to me is integrity. According to a Gallup poll done every year since 1999, nurses have always been ranked as the most honest and ethical profession, except for the one time in 2001 where nurses fell short only to firefighters after the 9/11 tragedy. To me, it is important and almost vital to build professional relationships with other nurses. The nursing community is a strong one, and becoming a part of it will provide a support system full of nurses who can empathize and guide and give advice. Plus, they probably won't get grossed out while talking about medical things at the dinner table. As a nurse, I would define myself as team-oriented, culturally competent and accepting, a critical thinker who likes to innovate and problem solve, and finally, a positive leader who works to improve everyone around me.